Legends, Dr. Tom here, backstage pass right in my office. I want to kind of give you some insight of how I work with my patients, either in a busy clinic day or before, work with my lifestyle educator, clinical assistant, getting ready for a day 2 tomorrow. But first, take a look here, some of the books that I use to educate my patients when I'm in consultation. References are really important. Primal Endurance book, one of my new favorite books, some other reference books, but I'm always not that organized, folks. What I hide here is stuff that's really not so clean, so I'm letting you really know what's going on. But let's turn our attention to, oh, there's our bucket full of medications, people getting off the meds. I'll push this aside here, Taylor. There's Keys to Success. We discussed that on day 1, so I tell them to take a picture of that with their smartphone. But today is really about what we put in our day 2 binders. Their name is right here. And now with our binders, we're putting these motivational Bellel-isms, and to get that through our printing and marketing company. And what we also get through our printing and marketing company are these nice tabs. My labs, my body comps, my program, my food journal. So I don't know if you can see that, Taylor, but let's zoom in a little bit. And yes, we do a picture of the person. I'm trying to hide her face and a side view. But what I really want to point out is I'm going through labs. I'm going to, of course, effectively use highlighters and red stickers and sometimes even stars or happy faces. You're going to see some red stickers here. Now, I'm going to give you a little crash course. I'm going to kind of go fast. You can always rewind this. But in her case, and she's a returning client, in her case, her hemoglobin's below 13.5, 13.2, so I'm suspecting low iron. Her white blood cells are over 9 and her segmented neutrophils are over 60%. So I'm thinking, I wonder if there's a hidden bacterial infection going on somewhere. Now, she's not presenting with a lot of symptoms. I know she has autoimmune thyroid because I diagnosed that 4 years ago, but she's coming back for more support. Glucose was high, but I don't think she was fasting that day. HDLs are high, which could be inflammation, too much wine consumption, or just good HDLs, right? So we're going to highlight that. I'll make some notes. But here's where I'm effectively using red dots. So red dot here is the ferritin's low. So I'm going to explain to her the importance of ferritin as a marker. That's really important. We're going to talk about C-reactive protein as a marker for longevity, obviously inflammation. And I put FB here. These are markers that if you have high, you're going to have a hard time burning fat. And if you want to get someone's attention and go, Mrs. Jones, with these markers, it's nearly impossible to burn fat. And that really gets people's attention because people want to burn fat, as you know. I know she has high antibody to thyroid, but I'm also noticing her free T3 is low, something we're going to need to address. I'm going to see if she did her temperatures. So I'm obviously utilizing the highlighter. I'm utilizing red stickers when I want to get their attention. There's her vitamin D levels, etc. So I'm going to keep on moving kind of fast here. The second set of labs we ran, I believe, was SpectraCell. Yeah. An omega report. So her omega report told me that her red blood cell membrane was 4.7% omega-3s. That's a little on the low side. We want to get that toward 8%. So I'm going to red sticker that as well and explain to her the importance of omega-3s and certainly what she should be taking and how much she should be taking. There's her SpectraCell, low in B12. Hey, interesting. Her lymphocyte white blood cell levels are low in vitamin D, and her serum was low in vitamin D on the low side, so obviously a correlation. So now we can do intelligent supplementation with respect to that. But here it is, folks, my favorite new lab. My goodness, it's the Wheat Zoomer. Forget about it. She wanted to know if she has leaky gut. She's been studying autoimmune thyroid for 4 years. She's been very proactive. She went to someone on Park Avenue, New York. This is not exaggeration. Now she's back with me. And yes, she has positive markers for intestinal permeability. Very important, including positive LPS lipopolysaccharide antibodies, which simply means there's some bad bacteria. And interesting, we found a relative high white blood cell and neutrophil count. Could it be coming from the gut? It looks that way. So now we have evidence. We need to heal up that leaky gut. We're looking at gliadin and glutenin. It breaks it down, looks at all these wheat proteins. It's unbelievable, and certainly gives a nice summary at the end going, yes, you have leaky gut. LPS indicates maybe some bacteria infection, which could be causing the leaky gut. So the point is, I want to let you know, you might not be at this level yet, but get organized with your report. Use stickers, use highlighters, have references available, so when you're doing your consultation report, they know you did your homework and you want to explain it. And I always have them record me. I always have them record me so they can listen to it and share it with their spouse. And I'm always working with a clinical nutrition assistant, and we're looking at like a dashboard here, excuse me. I hid the name here, Taylor, so we're cool. So on our Power to Practice, I can pull up someone's MRT. I didn't show you an MRT here, but I can just go right to my Power to Practice. Takes 30 seconds to load up. It's supposed to load faster than that. Here it comes. And I can look at a patient's MRT in advance before a consultation, of course. So that will pop up in a second. You see the blue line. There's someone's MRT, so I can get out of that. So the Power to Practice is a great tool for loading up the labs, having summaries, etc. So the point is, working with your assistant, we put the actual summary in the Power to Practice. We get this ready. She's coming in tomorrow. I'm prepared. I got the references. I know where we want to start. The protocol sheet will be made today. The products will be pulled today. It'll be behind me in an hour or two. When I come in tomorrow for this 10:30 a.m. report, me and my team are ready to go. I'm confident, and when you have confidence, you're going to send a better message and communicate much better. So head in this direction. If you need help with this, Dr. Tom Consults on drtombilello.com, or just stay connected to your modules. That's it. It's longer. This is what we do. It's a longer video. Hope you enjoyed it. Give me some feedback. Let's end this drug era in our lifetime and maximize our profits. Dr. Tom Bilello, Legends Club.